My name is Tiffany Howe, and when I look down at my foot, I feel like it doesn't even belong to me. I feel like it belongs to a foreign creature.
Her foot is huge. Big question is, what is going on here? Now you can see that her calf is much, much smaller, and it's almost got like a skin grafty type of a look to it. It does appear to me that she may have had some type of surgery done, but why is her foot so big? Let's find out a little bit more of her story.
Some people laugh, some people point. I play strong, like it doesn't hurt me, but inside you just want to go run and cry.
This beautiful woman is dealing with such a horrible, horrible problem. Now, if I had to guess, I would say that this is probably lymphedema. Lymphedema is excess swelling of various body parts, usually the arms or the legs, after damage to the lymph vessels. Lymph channels transport lymph fluid, which is protein-rich fluid, along with immune cells to various parts of the body, but it also helps to clear fluid, like let's say inflammatory fluid, from parts of the body. This is usually due to some type of cancer or infection in most cases. I don't know if this is what she has, but she looks like that could be the case. I just don't know what's going on with her calf, so definitely let's find out a bit more here.
I have a condition called lymphedema. It's a condition that I was born with.
So I mentioned that lymphedema can be caused by cancer, it can be caused by parasites like little actual worms can clog up your lymph vessels and your lymph nodes. But hers, she said she was born with it, so this is called congenital lymphedema, otherwise known as Milroy disease. And congenital lymphedema or Milroy disease is something that you are born with, that often the babies will have an enlarged foot or feet or legs, and it's due to abnormalities in those lymph vessels of that part of the body. It's autosomal dominant, so you can definitely pass it off onto your children.
And so with me, the lymph fluid is building up and it has to drain somewhere. So it's just draining from open wounds.
So essentially the lymph fluid is just staying in her legs and it's not being moved out of it and eventually just weeps out, it sounds like. Now the fluid in the lymph vessels usually moves through the lymph vessels through muscle contraction. So when you contract your muscles, it helps to move that fluid through. But in congenital lymphedema, something goes wrong with those lymph channels, not allowing that fluid to move like it's supposed to, and she gets this situation. It's a tough problem, and honestly, there's no real cure for it.
In 2006, they actually took 60 pounds from the knee down to the ankle.
So this explains why her calf looks the way that it does. So why would a surgeon perform an operation like this, and what does she get out of it? Well, surgery in general, unless lymphedema is very early, is not a true solution or a cure for it. But it can be used in a palliative situation where she may have masses hanging from her legs that are so big and so heavy that she can't walk very well. So surgically you can remove those masses and make her more mobile and able to walk and get herself around. The negative though is these operations are definitely risky with a high chance of infection and wound breakdown. Now when you're talking 60 pounds taken off her leg, it sounds like she probably had a lot of mass there that she just needed to have taken off so she can actually move around. Can you imagine a 60-pound weight stuck on your leg and how difficult it would be to walk around with it?
My biggest fear is actually losing my leg. And then ultimately I fear I might die.
Quite possibly the most dangerous thing that can happen when you have severe lymphedema like this is infection, cellulitis and abscesses. Because there's just so much fluid there, because the body itself is so weakened in that area, you can get ulcers. Those ulcers can get infected, and if that infection goes to your bloodstream, you could get sepsis, and yes, you can actually die from it.
So I'm removing Tiffany's socks and boots, and it kind of has that pungent odor to it. You can see the lymph fluid leaking out.
Severe lymphedema often does come with an unusual odor that he is mentioning here, and you can see that he says that that fluid is literally just leaking out. Typically it doesn't leak out through the skin itself, it has to leak out through little breaks in the skin. My guess is she's probably getting a lot of fluid coming out of that area that was operated on that still is kind of pseudo healed.
It's pretty bad.
So I know what you're wondering. How did she let it get so bad? So how do you normally treat lymphedema? Well, the first thing you do is you wrap the legs and you keep the legs elevated as much as possible. The key with lymphedema is trying to push that fluid out to prevent it from kind of accumulating like what she has. So elevating the extremity and doing compression wraps are usually the first line of treatment for lymphedema. Now it's possible, because it does cost money to do this, this usually isn't something that you can do very easily at home, that maybe she did not have the resources to get her treated, especially when she was younger. Got age spots? Don't undergo a deep chemical peel, which can take a week or longer to recover from. Instead, start by applying a good brightening cream containing kojic acid and licorice root. These are natural ways to reduce the melanin that your skin produces that causes these dark spots. At the same time, sign up for relatively inexpensive IPL treatments at your local doctor's office or med spa. IPL uses light energy to zap away the dark spots. After the treatment, you should notice those dark areas start to slough off within about a week. Always autojuvenate before you operate. More in my new book, Younger for Life. Go to autojuvenation.com or click the link in the caption below to get it. And if you pre-order it before it goes on sale, you will receive over $100 worth of free gifts.
The front of Tiffany's foot is massive, and she has a lot of leakage. You can see the fluid just leaking onto the ground.
How tough would that be to have all of that just leaking out of your leg all the time, every day, for all of your life, actually? What a horrible, debilitating problem for this beautiful woman. And I really hope that they're able to help her with it, because, man, this is one of the worst issues that you can develop with your skin and the soft tissues, short of cancer.
You know, maceration, it's almost like when we stay in the bathtub for too long, so we become very pruny. We can even see that you're developing ulcerations.
So those ulcerations are what really worry me, because when they get infected, then you get a cellulitis, and that's what we worry about that can really get her sick. Well, there are some patients who have severe lymphedema like she does, where they have a standing script for antibiotics. And even though it's a lot of courses of antibiotics, you don't really have a whole lot of other options other than doing an amputation, which would be even more debilitating for her. So it's just a really tough place to be. The first thing I would think about for her, though, if she hasn't been doing that, would be to start wrapping her legs regularly.
My plan for Tiffany is to not do any surgery at this time. With this condition, the risk of doing surgery is very high.
Why is the risk high for surgery with her? Well, it is possible to operate on lymphedema, and it's easiest when you have a lymphedema mass that hangs off the body where you can cut it off. And if you watch some of my reactions to My 600-Pound Life, you may have seen some of those operations being performed. But in her situation, it's kind of a growth of the top of her foot. And so taking that mass off leaves a big raw surface on the top of her foot without any real skin. And you also have to consider the top of her foot and the other parts of her leg, they're like huge sponges just filled with fluid. So when you cut into it, you just get a gush of fluid that comes out, and those tissues are very friable. They're not healthy to stitch together. So just a really difficult situation, and surgery would be very risky here as well.
The treatment plan that I have for you is a sequential compression device. It's like a pump that's going to really get all that fluid naturally out of your body.
So her legs are just filled with this fluid, and the only way to move that fluid is to cause the legs to actually get squeezed. Once again, lifting the legs up, keeping them elevated, and then these sequential compression devices, they're very similar to what we use in the hospital when we do surgery, except for they typically will wrap around the leg completely. And the idea is very simple. You want to try to squeeze most of that fluid out. Now, if you stop doing the treatment, that fluid can definitely come back because there's no internal mechanism to prevent that. But this really is a lifetime of these types of treatments, and that's what makes it so difficult.
I'm applying a sequential compression device to Tiffany's leg to milk the lymph fluid back up into her body and excrete it in a natural way.
So how much improvement can you get by doing this type of milking of the fluid and compressing the leg? Well, it really depends on the patient and how severe the problem is. Actually, performing the operation on her calf may limit just how much that foot will come down, because some of those lymph channels that fluid needs to move through may have been cut out at the time of the operation. But there are some pretty impressive success stories, some of them that I've actually seen on TikTok. Take a peek at this video right up here, where this person's undergoing compression wrapping of the foot and the leg over and over again, and you can see once that is completed at the end, That is a really, really big improvement. So I am hoping that they can get the same type of improvement for her as well.
So you're gonna help me out at home. It's gonna be 3 cycles a day, all right? And each cycle's an hour.
3 cycles a day for 1 hour. That's 3 hours a day that she has to be essentially lying down and these pumps working on her legs, which is a huge deal for pretty much anybody. That being said, also during the day, wearing compression socks can really help. Now, her situation is so extreme that she may be beyond that. As me not being an expert in lymphedema, I don't treat them actively in my practice, I can't say for sure. But in people who have lower levels of lymphedema, a lot of them will actually wear compression all day, pretty much every day, to keep that fluid down.
So I'm about to sign in and talk to Tiffany right now. I haven't seen her in a while. Where are we at with the ankle? The ankle was measuring at 39.
This morning, the ankle was at 28.
28? Look, Tiffany, you sound great. You look great. Your measurements are fantastic. Just keep it up.
What a tough problem for Tiffany, but you have to admire her spirit and the fact that even with this tough problem, she's still smiling and she's doing well. So I really hope for the best for her in the future. So Tiffany may not have the most alarming foot that I've ever seen on this show. The most alarming foot that I've ever seen is the one in this video right up here. What is going on with the bottom of her foot? You've got to find this out. And remember, eat real food, use clean skincare, and auto-rejuvenate before you operate.